And I'm here to do your abdominal assessment today, if that's okay. Okay, so do you need to empty your bladder before we start? And are you having any pain or tenderness today? All right, so can I have you bend your knees for me, put your legs up, and then put your hands by your side. Okay. Perfect. So I'm gonna pull this down just a little bit so I can see your umbilicus. And I do see that your umbilicus is inverted. I do not know I don't see any hernias present. And I see that you have no moles, scars, or lesions on your abdomen, and that your contour of your stomach is flat, and you have fine villous hair. I do not see any striae. I'm gonna look down, see if I can see your aortic and pulsating. And I do see your aorta pulsating, and I do not see any peristalsis. Okay, so now I'm gonna move on to auscultating all 4 quadrants, and I'm gonna start with the right lower quadrant. You just tell me if you have any pain or tenderness, okay? Okay, so you have normal active bowel sounds, and normal active bowel sounds happen 5 to 30 times a minute, and they're cascading whooshing sounds. If I heard for hyperactive bowel sounds, they happen more frequently, and they're more tickling, rushing sounds. And if I had listened for hypoactive bowel sounds, they wouldn't happen as frequently, and they're quieter bowel sounds. And also, if I heard any absent bowel sounds, I would listen again for about 5 minutes in the right lower quadrant, and I would listen to see if you had any absent bowel sounds. So now I'm going to move on to auscultating your arteries. So the first one I'm going to auscultate is your aortic artery, and then your renal, and then your iliac artery. Okay, so you just tell me if you have any pain or tenderness again. I'm going to move my stethoscope to the bell side as well so I can listen for bruits. Okay, so can I have you lift up your arms for me, both of them? Thank you. So this is her renal. And then her iliac goes by her umbilicus. Okay, I did not hear for any bruits. Did you have any pain or tenderness? Okay, you can put your arms down. So I'm going to move on to percussing your abdomen, and again, just tell me if you have any pain or tenderness, and I should hear timpani throughout. Okay, so I did hear timpani throughout as I percussed, and you did have some dual areas. That's just because you could have some stool in your abdomen. Okay, so now I'm going to move on to palpitations, and I'm going to assess to see if you have good muscle tone, and I'm going to assess to see if you have any good muscle tone and surface character. Okay, any pain or tenderness? What about over here? Okay. So now I'm going to move on to deep palpitation. Any pain or tenderness? Okay, and you do have good muscle tone and surface character. So now I'm going to move on to palpating your liver and your spleen. So can I have you move your arm up? There we go. I'm going to support your rib cage, and now can I have you inhale and exhale. Okay, I did not palpate the spleen. I'm sorry, the liver. I did not palpate the liver. Now I'm going to palpate your spleen. Now inhale and exhale. And I did not palpate her spleen as well. So did you have any pain or tenderness? Okay, so now can I have you sit up for me? Sit on the table, watch where you're heading. All right, so move your hair out the way if that's okay. So now I'm going to assess her CVA tenderness, and I'm going to find the 11th or 12th rib. Place your hand here. All right, so I'm going to palpate, so you let me know if you have pain or tenderness, okay? Okay. No, okay. Great. So you have no pain or tenderness? No. Okay, so that completes my abdominal assessment today.